What are you guys experiencing as far as, autoimmune triggers, how you feel, if you're dealing with some health issues that are, some inflammation, joint pain, rashes, fatigue. Boy, oh boy, is fatigue like a really big deal for autoimmunity, right? I mean, people are just feeling really, really exhausted. So that's been a kind of it's an interesting thing to navigate because like you could probably rally, but you just feel like bone tired, right? And just, you have to rally because you have to get going in your day, but you might feel like super wiped out. So that's something I'm seeing, and I'm seeing a lot of my patients today had inflamed joints, swollen joints that are kind of achy and sore, painful joints that seem not necessarily red and swollen, but just like achy and sore, right? That seems to be like a common thread of my day today. Um, had a patient that today that thinks they had a COVID trigger, right? I have another patient who thinks they got triggered by going into early menopause. That's a big deal. Someone says I have hypothyroidism, Sjogren's syndrome, fibromyalgia, and chronic anemia. Do you also have Hashimoto's? I would venture to guess that you might have Hashimoto's, since you have one autoimmune thing for sure, and fibromyalgia and chronic anemia. I just wonder if you also have Hashimoto's. Chronic anemia can often go along with autoimmunity. I see it so much. It's someone comes in with low thyroid or an autoimmune situation. Most people that have issues with autoimmunity have issues with gluten intolerance or celiac, one or the other. But gluten can make your gut lining really swollen and you don't absorb iron very well. So I often see iron anemia, chronic iron anemia, when you have an autoimmune marker, especially if you're still eating gluten. I don't know if you're eating gluten at all. And I mean, have you been tested for celiac? It'd be interesting to know because you have one autoimmune condition. Often your immune system can just turn on a dime and just attack something different too, right? So you can have a couple or two or three different autoimmune conditions. You have hereditary persistence of fetal hemoglobin. I have a 70% adult. Oh, that's really interesting. Yeah, that's very interesting. Um, and also I would say, I wonder if you have a hard time digesting food, or if you get bloating, or if you get fatigue after food. Sometimes if you have, say, gluten or dairy intolerance and you eat that, you can feel really bloated, or you can just feel really, really, really tired. Like food can make you just feel super like exhausted, or you can also get just like weird joint pain. You can get rashes, lots and lots and lots of fatigue. I'm seeing today. I was seeing a lot of fatigue in my office today. Yeah, so lots of people. Oh yeah, constipation, fatigue, and fevers. Now see, that's really common. It's a very common occurrence when you have an autoimmune condition. You can have recurring and remitting fevers. So fevers come and go. It's like part of the immune system being super overactivated. That's part of it. Now, also, if you have low thyroid, let's talk about that real quick. So low thyroid, fatigue, you might have Hashimoto's. I don't know. It'd be interesting to get tested for that. But when you have low thyroid, then you're not releasing enough thyroid hormone out of your thyroid. That's T4. Now, your T4 is responsible for your intestinal movement. So you probably have constipation from your low thyroid. Your T4 signals the intestinal motility, gets things moving, right? So that's a big, big deal. So if you need to be on thyroid medication, you should be on some. Okay, you're on 137, you used to be on 175. So, constipation and low thyroid, you might need to think about, like, are you on enough thyroid hormone? Do you need to be on, I don't know, do you need to be on a T4 and a T3 combo? Do you need to be on a little T3 too? A lot of my patients do need to be on T4 and T3. You see an endocrinologist. Good, good, good. So here's what I want you to think about though with that thyroid. I want you to ask your endocrinologist to run free T4 coming out of your thyroid and free T3. Now, Free T3 is what is usable. So you can take T4 as a medication, but about 25% of people don't convert T4 to T3 very well. So you could be a little low level hypothyroid, not functioning quite as well. If you already have some autoimmunity, I would think about getting maybe if you see a rheumatologist and a hematologist, I would think about getting off of gluten and dairy for a couple weeks. How does that make you feel? Does it make you feel a bit better or not really, right? I mean, it'd be interesting to do that just to see if you can absorb your iron a little better. Make sure you're eating enough protein, meat proteins that have iron in them. Beef and turkey and chicken and all the meats actually have iron in them. So make sure you're absorbing those. Now, the other thing that T4, right? T4 causes your motility in your intestines. It also drives the stomach acid in your stomach. So if your T4 is a little substandard, you're going to have low acid, you're going to have slow motility and a lot of constipation, and you'll get overgrowth of bad bacteria called SIBO. So it's kind of a thing that like tangles in with Hashimoto's and low thyroid. Okay. Okay. Somebody says, how can I tell if I have lupus or post-viral? dsDNA is 352, but ESR and CRP is 1 and 0.1, right? So it's kind of tricky, right? I mean, this is kind of a tricky thing to try to figure out, like, do I have lupus or do I not? Now, dsDNA can move to lupus. That can indicate, but it's only like one piece of the puzzle. They're looking at inflammation. They're looking at kidney function. They're looking at all sorts of different things and your symptoms. They kind of overlap all that to try to get you a diagnosis. So you want to be looking at something else called anti-Smith antibodies. There's a panel that you might have already had run called ENA. And ENA has dsDNA in it, but it also has anti-Smith. Now, if you had both of those, then you're making a bigger case for lupus, right? But if you have one of those, sometimes not, they'll kind of correlate it with your symptoms. Now, you can have these markers 5 to 10 years before you actually get full-blown disease. So if you have a marker positive and you're like, I don't have any symptoms or I don't feel so bad, now is the time. This is the time to strike. It's like, let's figure out what food triggers you have. Let's get you on vitamin D. Let's get you on glutathione. Do you have leaky gut? Like, what do we need to do? What marching orders do we need to put in place right now so that you don't develop full-blown disease? So if you aren't full-blown lupus, but you have markers, don't waste time. This is a time to kind of jump in and get that, let's figure out what's going on and how do we calm this down. Okay. Okay. Sorry. I'm behind on comments all of a sudden because I'm just yapping. Let's see what else. Did a sonogram on my thyroid and it says I have hypothyroidism and I have Hashimoto's. Yep. That's not uncommon. Now, also when you have Hashimoto's, you probably have issues with gluten and dairy. You might have issues with soy. I'd think about pulling yourself off of some foods. I mean, the top 5: gluten, dairy, corn, soy, and egg. All of those. You could just remove yourself with those and then move back in one at a time and see how it makes you feel. You also should be on 200 micrograms of selenium every day if you have Hashimoto's. So when you have an inflamed thyroid, this is swollen, you're releasing something called thyroid peroxidase, and that thyroid peroxidase can make you kind of anxious. It can attach to the back of your cerebellum in your brain, and it can make you feel a little bit dizzy and have a little bit of vertigo. Do you have any of that? That can be coming from Hashimoto's. All these things can kind of overlap. And this is why I'm trying to show you guys that these are all like a Venn diagram that kind of all overlap with each other. Why does my TSH show low and then stabilize? My TPO and globulins are high. Have a 5 millimeter right thyroid nodule. Okay. So your TSH, thyroid stimulating hormone, coming from your pituitary, TSH signals your thyroid and says, okay, thyroid, let's release some T4. Now, and then in your body, in your liver, in your intestines, you convert T4 to T3. T3 is the active, like rocket fuel, makes you feel like you have a lot of good energy, right? So we want to know all those numbers, T4, T3, and then TSH. Now, TSH, if your thyroid's doing its job, or if you have if you're taking thyroid hormone, it will signal back to your thyroid, to your pituitary to say, I'm good. And so this is just a quiet number. It's just a quiet whisper to try to get it to release T4. Now, if you aren't releasing enough T4 and it's really, really low here, then this has to screaming to get this going. And that's when your TSH goes high, right? So TSH is like a volume of yelling. So if your TSH it shows low, then it's like your thyroid is going to like be really active sometimes and not. Now, if you have Hashimoto's, if TPO and globulins are high, then that means that you can release a bunch of thyroid hormone at once, and then your TSH goes low and says, hey, we have enough. But then it might get deficient for a month and your TSH has to go up. It's like your immune system's like attacking your thyroid and it's breaking it down, and you have surges of thyroid hormone, but it's not consistent potentially. So sometimes you have to be on some thyroid medication to try to like give yourself some steady consistency. Hope that helps. Thyroid, the TSH whole thing it's really confusing, isn't it? It's ridiculous. Who else? I had a bunch more comments here. I don't know where they went. Okay. Hashimoto's, past thyroid cancer, and selective low IgM. What should I do about the low IgM? Okay, immunoglobulins. Immunoglobulins are made from proteins. So I want you to have protein at every meal like it's like your job. I want you to eat proteins. I want you to have eggs if you can tolerate them. I want you to have beef and turkey and chicken and shrimp and fish and all the things, right? All the proteins. That will help you. Your entire immune system is built out of protein. So I want you to like make sure you're digesting protein, make sure you're eating enough protein. So that's going to be your number one thing to do to make immunoglobulins. Okay. Now, if you have Hashimoto's, so your immune system is like active all the time. But it's interesting that your IgMs are low, because IgM is like telling you like what is active right now. What viral infection do you have? What bacterial infection do you have? That's very active right now. Now, if you have an IgG or an IgA, those are more delayed reactions. And they're like, hey, I saw this a long time ago, but it's not active. So I'm wondering if do you have an infection at all that you've been dealing with? Because that can run your IgM a little bit low. But I also wonder if you just need a little bit more protein. Like you need to be eating a little bit more protein. It's possible. But Hashimoto's, get off of gluten and dairy, see how that makes you feel. You might feel different. You might feel better. Remember, gluten and casein, the two proteins of gluten and dairy, look so similar to the tissues of our body. It's called molecular mimicry. It means that your immune system is like, gluten, dairy, my own thyroid tissue. I can't quite tell between the three of them. And so it attacks one and it attacks all of them. And then they all start like revving up your immune system for more attack. And that can really happen. So if you got rid of those food proteins and you felt better, then it might be a solution for trying to calm your Hashimoto's down. Also get on 200 micrograms of selenium every day, or eat like 2 big Brazil nuts. You know, the mixed nuts, there's that weird one that's really big. That's called a Brazil nut. And 2 of those Brazil nuts give you around 200 micrograms of selenium every day. So you could take those, and what it does is it helps to lower your thyroid peroxidase, your TPO. It lowers that. So the TPO floating around, thyroid peroxidase, can attach to the back of your cerebellum in the back of your brain, and it can make you feel really like unsteady, unstable, a little bit of vertigo, a little bit anxious, a little bit spinny, a little bit like, am I dizzy? Or the crowds make me anxious. That's what it can do. I don't know if anybody feels that, but it's kind of common with Hashimoto's. So lots of things to consider. We've got, I'm getting a lot of love. Thanks, you guys. I'm always sick. Yes. Okay. So, here's some things I would think about. Sure. I would think about get the protein in. You know what I would think about? I would do some like protein and veggies for a little while, right? Like maybe just proteins and veggies for a little while. Just like really get your diet really simple and see if you notice a difference in how you feel. I also want you to take vitamin D like it's like your job too. Like I want you to do like 5,000 IUs of vitamin D every day. You can also do, you know what I actually would rather you do? I'd rather you get a vitamin A, D, E, and K cut together. Those are all fat soluble vitamins. I would have you take a decent amount of that every day, enough that you're taking 5,000 IUs in that grouping of A, D, E, K. And the vitamin A can really bolster your immune system. Same with the D, but so can the protein. So make sure you're eating meats. So yeah, let's work on that. Okay. I notice white dots on my arms. What can I use or do? Are they white dots like back here, like they're kind of raised bumps? Um, they call that keratosis pilaris, I think is what they call it. So it usually is associated with gluten issues. It's usually associated with if that's what you're talking about. It's usually like people have, if you eat gluten and you don't do well with it, like you're just kind of gluten intolerant, or it just kind of gives you a little bit of a bloaty stomach ache, whatever, it can make your intestinal wall a little swollen. And then you're not absorbing the essential fatty acids like omega-3s and all the good oils. And that is like an essential oil, like vitamin, like omega-3, 6, 9, like deficiency on the back of your arms. That can be, so it can be like this weird trajectory toward like gluten intolerance. So if you got off gluten, so I wonder if that would make you feel better, would make it go away. Can people with histamine issues do glutathione? That's a really, really good question, Lizzie. Sometimes, a lot of times, but not always. So glutathione is made in a lot of sulfur. And so sometimes sulfur can be triggery for people with histamine issues, but sometimes it doesn't cause any problems. So I'd probably get a small bottle of it and just give it a trial. If it made you feel kind of yucky, it would be pretty transient and you'd be like, okay, then I have my answer. Now, if you have sulfur detox issues, oftentimes you can take a supplement called molybdenum. It's a mineral, molybdenum. Weird word, right? Molybdenum it helps binds to sulfur and helps to detox it through your liver. So if you felt like I'm taking glutathione, it makes me have hives, I would pair it up with molybdenum and see if it makes you feel different or better. Things to just try. What else? Let's see. I notice I feel flared when I try, but I want to heal my gut. Okay, so you feel like glutathione maybe flares you. There's other ways to heal your gut, super other ways. So let's not do glutathione then, because I don't want you to get, sorry, I'm gonna sneeze. I don't want you to get all flared up. So I want you to think about, I have a really cool product that I love for we're trying to heal your gut. It's called Repairvite. It's by Apex Energetics. I'm happy to send you a link if you want to send me a DM with your name and like your email. It has glutamine, aloe vera, calendula, chamomile. It's got, what else? It's got some enzymes in it. It also has diglycerized licorice. I'm just trying to think of all the things. It has a lot of healing things in there. I would also think about maybe getting on a supplement that has a short chain fatty acid in it, like butyrate, acetate, propionate. Those are really healing to your gut lining. You could do both of those, and it might be helpful. You could also do a very simple Repairvite that has glutamine and it has zinc carnosine, if you want to go really simple, right? So if you want some help with a link, just let me know, okay? Thoughts on GLPs. Okay, so GLPs have been really interesting, right? So let's say you have a little too much weight around our waist, right? This extra fat we get around our belly actually creates its own inflammation. It just creates, it can increase your CRP just by sitting there, right? So if we change our cravings and our diets, we can lose that fat, we can lower inflammation, we can kind of get a handle on this stuff. Now, that's the mechanism that I've been aware of, right? I have a autoimmune support group. I have one on Tuesdays, and I actually have the one that's open up on Fridays. I'm going to tell you guys about. But the person on my Tuesday group has severe rheumatoid arthritis. Like, she can barely use her hands. It's just a hot mess. And she's in Georgia, and we're doing all these supplements. We're trying to help her figure it out. We're trying to figure out food triggers. She got on a GLP-1. I think it was Zepbound. I mean, her inflammation in her hands stopped that day. that she got on this injection. And I'm like, what is the mechanism behind this? I don't know. I mean, it's supposed to be lowering inflammatory cytokines. It's supposed to be changing your immune system from, Th17, which is inflammatory, to a different pathway. So uh, it was like right in front of my eyes magic. So, and I'm telling you, I slaved with this girl trying to get her with so many supplements. Like, listen, I was like going over backwards trying to figure this out. About at the end of my rope, and she tried this, and she's like, "Listen, my hands don't hurt anymore." I'm like, "What kind of black magic is this? Are you kidding me right now?" So, listen, I mean, okay, I will take that, right? Now, will that happen for everybody? Not necessarily. I mean, everybody's got a different fingerprint on their autoimmunity, right? We all have different triggers. We have different things that make us worse and better. Like, this is why it's hard to kind of put down a recipe for this. So, damn, I mean, I'm kind of like, I was floored. So, yeah, that's my thought on GLP-1s. It kind of blew me away. Um, let's see what else. Living with Sjogren's, can't tolerate medication, now with high liver enzymes. Okay. So, all right. So let's talk about this. So, a lot of people want to get on a medication to calm down their immune system. And some people, it works really well. Some people can't tolerate it. We need different choices, right? So, let me just quickly tell you this about this autoimmune shift program that I've created. It's an autoimmune support group on Fridays. We meet on Zoom at 11 a.m. Pacific on Fridays, every Friday. There's 13 different videos that I made for some really good education about all the one-on-ones for like taking a course on autoimmunity. There's resources and downloadables, there's diets, there's things that work, supplement links, there's everybody gets 20% off of supplements if you're in the program. It's a group of people and we meet on Fridays. Fridays, we have about 7 people in there right now. My Tuesday group is full. We've opened up Friday. It's $50 a month. I just wanted a really low cost group for you guys to be able to like have a support group, be able to ask questions on Fridays on Zoom so I can see your faces and I can talk to you versus just answering questions. But if you want to join that, there's a link in my bio. It just says Linktree. Just touch that and it'll go right to, it's called the Autoimmune Shift. And my goal is to get people to do small shifts every week, every month to change their diet and their food and their supplements to try to get their immune system to calm down. So that's what I say about if you can't tolerate medications and you want some support, that's a resource that you can go to. So join us if you would like. I'd be happy to help you kind of walk through that. But let me tell you my ideas off the top of my head. Vitamin D is important. Vitamin D at 5,000 IUs is important. I would love for you to commit yourself to vitamin A as well. Anytime we're dealing with like mucous membranes, like sinuses, like your mouth, like your nose, your throat, even the insides of your intestines or the insides of your lungs, like if you have a lining problem, right? Like it's like Sjogren's is kind of like dry and the glands, the salivary glands don't work that well. Vitamin A can help. So I'd say get on vitamin A, get on vitamin D. You can actually get on a supplement that has both in there, which would be helpful. There's an A and D. I think Designs for Health has one. Let me know if you want a link to it. You can always just order it under like full script so you can get a really good supplement. I would think about doing glutathione with you. If you can tolerate glutathione, do it. Not everybody can, but a lot of people can. And it actually can calm the immune system down. So immune system is doing this, really high overacting, attacking you. Vitamin D and glutathione are immune system modulators. They just get you rolling a little bit more. Lots of things can be immune system modulators. So keeping your blood sugar steady can really modulate the immune system. Decreasing inflammation, exercise that you can tolerate. Like there's so many things I want to tell you. There's so many strategies, but I would start with A and D and high liver enzymes. Hey, let's go for like some dandelion root tea. Let's get your milk thistle tea out. Let's make some teas. Let's take some supplements. Milk thistle and dandelion root, amazing for the liver, like legitimately magic. So let's try that. So lots and lots of things. I have a non-length dependent small fiber neuropathy that is post-viral. Okay, so we want to think about anytime you have a post-viral something with the nerves, it's almost always autoimmune, right? So the virus flared up the immune system And what can happen is the viruses can actually like hide out. It's like a bad game of hide and seek. They're hiding out in your tissues. Then they have this thing called a biofilm that they hide in. It's almost like a sleeping bag or a little tent, right? And then your immune system's like, hello, I'm trying to find all of you. I want to kill all you. And they're all killing some things. But then the immune system's like, listen, there's some viral tissue in the nerve. I'm going to go ahead and attack that. And I'm going to attack the myelin. Oh, and I'm going to attack the joint. Oh, and I'm going to attack the thyroid. And this can happen, right? The immune system's like, I'm just trying to keep you safe, but there's a lot of like hide and seek going on that's gone bad, right? So that can happen. And so when I hear of post-viral, I think the immune system's overactive. What do we do to chill it out? How do we modulate it? Glutathione, vitamin D. Also, you might need to be on some viral antiviral things, like sometimes lysine can be helpful if it's a EBV trigger or herpes family trigger, Epstein-Barr, herpes viruses, shingles, chicken pox. Those are all herpes family. That lysine can be helpful with that. Monolaurin can be helpful with that. There's a supplement called lauracine, and lauracine has lysine and monolaurin in it, which can be helpful for antiviral. That can be helpful. An herb called astragalus can be helpful. No, andrographis, sorry, wrong word. Andrographis can be really helpful for being antiviral, but also vitamin D and vitamin A, and figuring out food triggers, because when you have autoimmunity, you often have issues with gluten and dairy. Well, it can be gluten, dairy, corn, soy, egg. It can be nightshades. It can be nuts and seeds. Like there's some things that we have to consider, because if your immune system's attacking something in our body, let's say it's attacking the nerve tissue, it might say, I'm attacking the nerve tissue, but the nerve tissue looks a little like dairy. So I'm going to attack both of those, and the dairy is going to flare this up. It's called cross-reactivity. It's like attack this, attack that. It's like a bad, bad game. So I would think about lots of things to support you. I can't find the pricing to work with you on your website. If you can, yeah, listen, I have a new website coming out in about 2 weeks. My website is like, it's a piece of trash. I'm sorry. So here's what you need to do. Go to my link tree in my bio, and just go to the link tree, touch that. It'll say autoimmune shift program, and you click on that and it shows you the program that I'm doing with the autoimmune support group. And then it says work with Darla. And there's a link there to make an appointment with me if you want to do a one-to-one, 30 minutes, an hour, whatever. Send me your labs. That's fine. I do that too. So if you can't, let's see if you can't find that, or if you're like, I can't find it, send me a DM and just send me a DM on, just message me on TikTok. I don't always get in the comments. There's too many comments on my videos, but I do answer the direct messages. Okay. So just send me that. It has helped me a lot. I'm down 50 pounds and haven't felt better. I'm so proud of you, Carrie. That's so great. You know what's great? Here's what's great. Let me just tell you a quick story about blood sugar. I mean, this is like, listen, this is like the most exciting thing. So let's say you have prediabetes, or you just have blood sugar issues and you've gained 75 pounds, let's say. Now you have all this sort of fat on your belly that creates inflammation. It's like a bunch of traffic, right? And then you eat food and your body has all this inflammation traffic. And so it gets in the way of telling your brain that you're full. It's super terrible. So now if you're overweight, you tend to eat more and you tend to overeat because you don't get the signal that you feel full. And you have super food noise out here that's making you crave food. So these GLP-1s are like, let's take away the food noise. Let's get people more in control of their hunger and their bodies. And let's just get you to rein this in, right? Now, here's your goal, Carrie. You have to really focus on protein. I need you to eat protein like it's your literal job during the day. I need you to have it for breakfast, lunch, and dinner, because you can lose muscle when you're losing weight. So I want you to eat protein. I want you to be like doing squats. I would love for you to do some weights because you really want to build up your muscles, because I'm worried that I don't want you to have a lot of muscle loss. Okay. Also, GLP-1s can cause constipation. So you want to maybe you take some magnesium oxide, maybe you take some magnesium citrate, maybe you take like a motility activator, something like that. There's a lot of really, really good supplements that you can take to get your intestines moving. Okay. So I'm proud of you. You're doing great. I mean, it's just like letting you out of jail, right? Like, listen, let's just make this more tenable. So good job. I'm researching all kinds of things. Oh, there's so many things to research, right? It's crazy. I have really dry eyes. The only thing that helps is Sustain Gel, not even Zedra helps. Okay, so I feel like we need to get your immune system to like maybe back off on attacking your eyes and your fluid in your eyes, right? Vitamin A could be really helpful for you. Maybe you do an AD combo. Maybe we do that. I think that might be helpful for you to see if we can help to. These are like mucous membranes, right? It's like Sjogren's. Sjogren's can be such a pain. Oh, what time? So Fridays we have an autoimmune support group on 11 a.m. Pacific. So it depends on where you are in the country or in another country. So it's 11 a.m. Pacific on Fridays for an hour, and we do Zoom. We answer questions. There's also a portal. It's an app. It's called Kajabi, the app, and you hop on there, and there's like literally a private like Facebook feed where you go in and you say, here are my wins. Oh my gosh, this is how it's going. My week sucks. Please help. And it's just like a whole support group, and we can, support and message each other through the week. If you eat a really great meal, you take a picture and post it on the link. It's like a feed, right? It's kind of like Facebook. I just didn't want to put it on Facebook because it's just, no, thank you. We're doing our own private Facebook on a platform called Kajabi. So yeah, if you want to pop on over. Okay, vitamin D and K. Oh, so yeah, D and A, right? But see, think about your fat-soluble vitamins are A, D, E, and K together. Those are all fat-soluble vitamins, right? So usually you can get D with K because that helps you to take calcium and put it into your bones. So important. You can put those together. That's great for your bones. Important. But if you're working with just your immune system, you could just do D and A. You could do an ADEK together. That's fine. You're not going to OD on that stuff. You just want to look at if you had an ADEK together, you want to look at the D and you want to go, okay, my goal is to get to 5,000 IUs of vitamin D every day. That would be 125 micrograms. So if you hit that dose, that actually helps you to figure out how much D, A, D, E, and K all that you want to take. So you could take it all together. And if you need a link, let me know. I can send you a link through FullScript because these are really, really good supplements. But I want you to make sure you're getting good supplements, right? Oh, I'm happy to help, Kudzu. I'm really, really happy because this is why, like, I just want to put all this info on blast. It shouldn't be living in my head. I should be able to, you can blame my 26-year-old daughter who's like, you better get on TikTok. And I'm like, okay, tell me how to do it. Right. And now I'm like doing lives. So proud. I've had some kind of rhinovirus for a couple of weeks. Still have a lot of congestion at times. Yeah, that rhinovirus this year, I had it like 3 or 4 weeks ago. It actually created some asthma in my chest. It was really quite aggressive. It was not nice. I did glutathione. I did, what did I do? What was helpful? NAC is helpful. NAC makes glutathione. Whoever was sensitive to glutathione, can you maybe take NAC, N-acetylcysteine, NAC, N-acetylcysteine? That is a precursor for glutathione. So maybe if you want to take glutathione and you can't tolerate it, you can take NAC. There's a really cool supplement by Apex Energetics that's called Glutathione Recycler. It's got NAC, milk thistle. Am I going to come up with the other things in there? Probably not. It's not coming to my head. Anyway, it helps your body to make glutathione. And it's for people who can't tolerate glutathione. So anyway, if you want a link, let me know. Because it's just FullScript. Have you guys heard of FullScript? It's like this little portal we can order through, and then I can give you guys discounts and stuff like that. And I put everybody in my autoimmune support group on a discount in FullScript because you guys are spending a lot of money on supplements, right? It's suppressive. So you know what? If you have still a lot of congestion, can you make a little salt water and kind of do one of those little sinus irrigation things? Because we really just want to wash all this junk out. Okay, it's really helpful to wash it out. NAC is helpful also for lung congestion. It's kind of like a natural Mucinex. Super helpful. Oh, vitamin A is bad for my intracranial hypertension. So important, Lizzie. So we need to be really careful about too much vitamin A. See, this is why everybody's different, right? We can't have like a blanket recipe for everything. We got to figure out what's best for you. Maybe we just do the D for now, right? Maybe you could do a D with a K. I don't know. NAC makes you feel nauseous and turns up rosacea. Okay, so we're going to think about something else. Can you do, have you ever tried black seed oil before for an anti-inflammatory piece? Black cumin seed oil. Some of my patients have had good success with that. Another thing that's really helpful too in the antihistamine world for hives is perilla seed oil. It's Perilla, perilla seed oil. It's from the perilla seed. Really cool antihistamine, really great for hives, really effective if you feel like, I don't want to take antihistamines that I mean, we want to get to the bottom of why you have hives, but if you did, but anyway, I'm going off on tangents. So, progesterone allergy, could it be due to autoimmune disease? Isn't that interesting? I actually don't know. That's a stumper. Huh. I actually don't know. I mean, it could be, but also are you on a progestin or are you on progesterone? Like, have you tried both of those? I would be curious since it's a hormone. It's a hormone. I would think it would be autoimmune, right? You've been using the neti pot, salt gargle, Flonase. Perfect. Yeah, you want to kind of just be washing all that stuff out, but also, a lot of people are getting secondary infections like sinus infections from the rhinovirus this year. People are getting bronchitis. People are getting pneumonia. It's kind of crazy. So thinking about really like kind of recovering from that, right? I mean, antivirals, you could do some andrographis, ANDRO, graphis, GRAPHIS. Andrographis is really, really an interesting herb that not many people have heard about. My Chinese medicine doctor in my office turned me onto it, and we used it a lot during COVID. And it's just really great antiviral. It's really strong. So I don't know, something to try, something to check out. Yeah, do great with 5,000. I use vitamin D and K. Good. Great. And selenium. Yes. Yeah, that's awesome. Perfect. So anti-Smith is negative, but I'm very worried because I have terrible brain fog and memory now. Okay. So we need to think about brain fog. Let's just talk about brain fog real quick. So we need to think about, with brain fog, I think of a few things. I think about inflammation of the brain. COVID caused a break in the blood-brain barrier between the blood vessels and the brain. Now, you got to think about blood vessels going up into your brain, almost like a tree, like these branches of a tree. They're wrapped in a real thick blood-brain barrier because the brain doesn't want to just have everything come in through the bloodstream willy-nilly. Like, what if you had like mercury in your bloodstream? What if you had viruses and bacteria in your bloodstream, right? You don't want it to go straight into your brain. So, but COVID made holes in that barrier and made it leaky. So that's an interesting thing to recover from, right? So that's one thing I think about. And I can give you a couple of different really interesting supplements that are anti-inflammatory for the brain. One being a supplement that I use, it's called NeuroFlam. It's by Apex Energetics, and it has like all the flavonoids in it, like rutin, apigenin, turmeric. It's got all sorts of like quercetin in there. And it helps, it's crossed the blood-brain barrier, and it can really cause your brain to be less inflamed. So if you were my patient, I would say, I don't know, we should try some NeuroFlam and see if it makes a difference. Maybe we take 6 or 8 a day for 2 weeks. Does that make a difference? Yes, no. If no, okay, that's not the mechanism. But if yes, we have an inflammation mechanism happening in the brain. So you can use supplements to kind of like be a diagnostic tool, right? You could ramp it up for 2 weeks. If you don't notice a difference, then, I mean, you're not going to necessarily notice a difference on like maybe on vitamin D or like a vitamin per se, but like maybe glutathione, you might. Glutathione can go across the blood-brain barrier. You should think about doing some glutathione. But also, when you have terrible brain fog, I want you to think about the food you're eating. I want you to think about gluten, and I want you to think about dairy. And I'd love for you to like just hop off of those for a couple weeks and see how it makes you feel. Now, here's another thing you could go. You could really go for it if you were really in the mood to really go for it. If you're like, I'm sick of this, I really want to do something. Get on an autoimmune paleo diet, AIP, autoimmune paleo diet. Here's what it is. It's pretty much meats and veggies, okay? So you would remove for a little while just all the grains, dairy, eggs, nuts and seeds, peas, any lectins, and nightshades, which are like tomatoes and peppers and eggplant. You would remove all those guys. And then you would just eat like that for, I don't know, 10 days or something, 2 weeks. And then you slowly put a food back in. Eat a tomato, see how it makes you feel. Put in something like an eggplant, put in some peppers. No problem. Great. Nightshades are back in. Now you move to lectins, right? Nuts and seeds, one at a time. How do they make you feel? Fine. Great. They're back in. This is called an elimination provocation diet, right? And it's just a diagnostic tool. It's better than any food allergy test you can run on the market because you're watching for your own symptoms, right? Magic stuff. So you could do that. And if you do that and your brain fog and memory gets better and your brain fog goes away, that's your answer, right? Also, just get on fish oils. Did you have a head injury? I do a lot of work with head injuries too, and Parkinson's and Alzheimer's. So sometimes you can get a head injury and you can have terrible brain fog, right? Things to think about. IVIG. So thoughts on IVIG. So it depends, right? Now, I have patients who got terrible post-COVID autoimmune syndrome. And I have a handful of people that did IVIG and felt better. I have a large amount of people who did IVIG and didn't feel better. There's also a medication called low-dose naltrexone, LDN, low-dose naltrexone. It helps some patients. Some patients it doesn't help. This is what's so frustrating about autoimmunity. This is why I'm specializing in this because, guys, it depends. If you have an influencer on Instagram that's like, take this supplement, it's going to heal your autoimmunity. Just listen, garbage, because you don't know. Some people can take certain things. Some people take them and it flares them up. So this is like the immune system is the most complex thing I've ever seen in the human body. Like, you think the brain is complex? Talk about the immune system. It changes. It's different. It's attacking. It's not attacking. You can influence it. That's the game we're trying to play, right? But it's complex and everybody's really different and the triggers are really different. So sometimes IVIG helps. Compounded progesterone pill causes histamine reactions and early ANA test. Interesting. I wonder if it's the progesterone or I wonder if it's what it's compounded with. I would talk to the compounding pharmacy and I would say, what is in here? And here's what's cool about compounding pharmacies. Let's say they compounded it with some coconut oil and some rice starch, and you had an allergy to one of those, you could get them to compound it with something different. You can get them to put it in olive oil. You could get it to put it in something different. So I wonder if it's not the progesterone. I wonder if it's the binders that's in there. That's what I would do. Something is triggering you though, for sure. My sleep may be a factor. Sleep is really, 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 really important. I can't get autoimmunity to calm down unless you guys are sleeping. Like, that's a whole module in my videos. It's like, let's talk about sleep. Trying to solve for sleep is like, woo, it's a big thing, right? So your sleep can be a factor though. It's been scary. I have stenosis mixed with post-ill or autoimmune. Okay. Stenosis. You have stenosis where? Stenosis in your spine, stenosis in your sinuses, stenosis. Tell me more. Tell me more. Oh, you're welcome. Glad to give you guys some advice. This is why I like hopping on these lives, because I feel like your medical doctors and your rheumatologists they don't have ideas. They don't have ideas. They're just like, okay, you do these, they're great diagnosticians. The best, actually. Like, they nail the diagnosis, right? But first of all, you have to have enough symptoms and enough positive markers on your blood work to get a diagnosis. And then you have this diagnosis and they're like, well, I did my job. Good job. Yay, you made the diagnosis. So what? So what do I do now? Well, you have this medication or this medication. And you know what? Listen, sometimes it's important to take the medication because you're going to calm your immune system down. Amazing. But What functional medicine strategies do we need to braid into this to make this more effective, to make this work better? And how do can we get to a root cause? Do you need hormone replacement? Do we need to help you figure out how to sleep? Do you have food triggers? Yes. Almost all y'all have food triggers and you probably don't realize it. It's a wild thing. I didn't realize it either till I got off of food and I was like, dang, I just thought I had sinusitis. I don't. I have a gluten sensitivity and a dairy sensitivity, and I have an autoimmune marker. So does my daughter. So I'm super, super, super passionate about handling autoimmunity. Like, it's nothing like having it and having your 20-year-old kid have it. You're like, oh, let me just learn all the things in the entire world about it. So that's why I made a program, because she's bullying me to do it. And it's a good thing. Okay. Having a very hard time falling asleep most of the time, I take Unisom, which works well. Okay, falling asleep. Falling asleep is definitely different than waking up in the middle of the night. So falling asleep, I want you to think about getting some different herbs on board, okay? Valerian root, passion flower, chamomile, catmint, all of it put together with maybe some L-theanine. Great. I mean, I have a really cool syrup that's called Neurocera that's by Apex Energetics. I love Apex Energetics. It's the best. I love that company. There's a lot of companies I love, but that's actually my heart. Love them. Neurocera is a little syrup. You can take a little tablespoon of it before you go to bed, and it'll make you sleepy. Let's push into some valerian and passion flower, no matter how you get it, no matter how you try it. Let's try it. See if it makes you sleepy, because you need some help. You could also, if you feel like, man, I'm just like revved up and my cortisol's high, you could take some. I love a supplement called Cortisol Manager from Integrative Therapeutics. It's got magnolia root, it's got phosphatidylserine, and it helps to degrade cortisol. So let's say you're like a cortisol gal and you're like, oh my God, my cortisol is just spiking. I'm super stressed because I don't know. I just watched the news and the world is falling apart. So, okay, your cortisol is high. What are we going to do about it? How do we get you sleeping? Because we kind of can't have you falling apart. So magnesium's good. I like Cortisol Manager, magnolia root, phosphatidylserine, cortisol degraders. Remember, your cortisol's up in the day, but your cortisol has to come down at night. It has to like go lower than a certain level so that then melatonin will kick in. So if your cortisol is staying high, melatonin is just sitting in the wings waiting for the cortisol to drop. You could take a walk, just like walk off your cortisol. You could take some magnesium. You could take a hot bath. You can take, there's ways to get cortisol down, but things to think about. Falling asleep is all about cortisol and just like getting some valerian root and some passion flower in. Can you use a neti pot too much or saline sprays? Does it have a negative effect? No. Nope, you're just washing stuff out. I mean, you could wash, listen, it's really interesting. I learned not too long ago that in Japan, they teach the little kids when they come in not to wash their hands. They wash out their nose and mouth when they come home from school. And their rate of getting sick is a lot better than ours. How smart is that? I mean, you're going to breathe this stuff in, right? It's coming in through your nose and mouth and your hands. Pretty cool. No, so you can't do it too much. Oh, you have stenosis in your cervical spine. Thank you. Worried about myelopathy. No doc has been helpful. Very scary neurosymptoms. Okay. Have you found yourself a physiatrist? Do you know about a physiatrist? These are medical doctors, and they specialize in myelopathies and neuropathies. And so they're like kind of a branch off of sort of like orthopedic surgeons. They often work with like spine orthopedic surgeons. I have a couple that I work with that I send patients to when they seem to be having neuropathies and myelopathies. And they're magic. They really look at the nerve impingement as it comes out of the spine to make sure that there's not stenosis happening. So if it's a physiatrist, 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 I would ask your doctor to be referred to a physiatrist. See if that's helpful for you. Those guys they know their stuff when it comes to stenosis. Yeah, I don't like those neurosymptoms. That's not okay. You are really, really, that's really scary. So, and also, it's like, and yeah, they'll give you things like, just like Kudzu saying, is all yours offers is gabapentin. Okay. Yeah. Gabapentin is just like, I mean, it can be helpful if you have really crazy nerve pain all the time, but there are other ways to kind of manage this. It can make you feel really sleepy too. The GABA and the gabapentin makes you really sleepy. So not always a great solution. So autoimmunity, there's lots and lots and lots of things you can do to help, right? Also, I also tremor throughout the day. Worried illness or stenosis or COVID caused a neuro problem. Okay. So, okay, tremor. Tremor, is this a tremor in action? Like if you do this, if you lift up your cup and you put it, does this shake? Or is it a tremor at rest? Tremors at rest tend to be coming from a part of the brain that kind of lives in sort of a Parkinsonism place. Doesn't mean you have Parkinson's, but it just kind of is in a land. It's in a place in your brain. A tremor at action, when you're lifting something or you have something heavy or you're moving something and it shakes, that tends to be coming from your cerebellum in the back of your brain. It's called an intention tremor. Just things to think about. You might get inflammation from COVID in your brain and your spine, and it can cause these weird things. So do we need to do anti-inflammatories with you? Turmeric is an amazing anti-inflammatory. Black cumin seed oil is an amazing anti-inflammatory. Glutathione is an amazing anti-inflammatory. So if you have stenosis, you could do any of those. You could do fish oils, really, really good anti-inflammatory. So let's push into those things. And that you might notice a big difference, because when your nerves are getting pinched, just getting a little bit more space can make all the difference. Okay. So let's try something like that. And let's see if we can find you a physiatrist. Okay. Because really tremor things, people can get tremors when they're anxious and they're low blood sugar. So that's another thing that can happen. There's different tremors and they mean different things. So you want to know how does this happen? Yes, I take some of those. Weird thing is, I've had a normal EMG and ESR and CRP are 1. Okay. So there might be inflammation though, living like in those joints where you have stenosis in your spine, right? So here's what physiatrists do is they'll often do an MRI and see where you have like impingements, and they'll do a little bit of a steroid injection right in that nerve. Just get that nerve to calm down. And then it sometimes really takes the pain away. I don't know if that's a solution for you. I don't know if you've tried that. I don't know where you are in your journey, but I send a lot of my patients over to a physiatrist to get injections if they have pain, nerve pain. Or they have like a disc bulge that's going into a nerve root that's shooting down the side of their leg and into their foot. And their foot is numb. It's like, go to the physiatrist. Got to do that. So, I think that we need a smarter person to work with you and figure this out, right? So, I will re-mention to you guys that, just no pain, just neuro symptoms. Yeah, so you got to think about the nerve root is like a cable bundle, okay? So you have like this part of the cable bundle works with pain. This one works with pain and temperature. This one causes motor function. This one is going to be like vibration. This one might be something completely different. So like light touch or deep touch. So it's like a cable bundle. So if you have impingement going on one part of that cable bundle of your nerves, you might only get like a weird neuro symptom and you're not going to get pain. Pain might be on the opposite end, or it might be more centralized inside the nerve. So that's why it's complicated. That's why not everybody's the same when it comes to these things. So, when we are thinking about, I want to just re-mention for those of you, you have a 3.8 centimeter lesion found on a CT scan. Okay. So, where's the lesion, on the CT scan? There's all sorts of places that you can get lesions, like your liver and your pancreas and all sorts of things. So tell me where you got a lesion. Accidentally found. Where is it? Because that's always an interesting thing. When you do sometimes these CT scans, or they do the Pronovo test. Oh, on your kidney. Okay. Yeah. So are they doing like some imaging on that, like just monitoring it and kind of keeping an eyeball on it, because it's important to know. You want to make sure that all is well in there. They can do those like Pronovo scans that are like a full body MRI. My husband did them. It took like, he was in the MRI for like an hour and a half. I think I would have a heart attack being in an MRI that long. But it showed weird things. Like I figured out that he had this big thyroid nodule, and I tested him for Hashimoto's. We got a biopsy, all these sorts of things. There was a lesion on his liver. There was a little bit of a nodule like on his pancreas, like, and then you could see all sorts of like arthritis type things that he has, but really, really fascinating. So you find these things out, you want, yeah. And the 1.5 on liver. So yeah, went in for something else, and then you find this thing, making sure you're just imaging it on the regular, just to make sure that nothing like wacky is happening with that. Right. So yeah, bodies are wild, right? I mean, who knows what's going on in these bodies? We don't have x-ray vision, right? So I'll mention to those of you that just joined in, I do functional medicine. I look at people's labs. I normalize their lab values. We try to optimize their lab values. I also specialize in autoimmunity. So because I just see so much of it. So I have an autoimmune support group I've developed on Fridays. I have a Tuesday one that's already full, but the Friday one is open, and I have a few members already that have joined. It's $50 a month, which is all. And let me tell you what it is. It's a bunch of different videos that you can learn about autoimmunity, how to calm it down. And then you have links to different resources on like little diets you can try and supplements you can try and resource links for supplements. And then there's an autoimmune support group. There's all sorts of downloadables about essential labs you need to get, how to read your labs, so much information in the resources. And then you can jump on a Zoom with me on Fridays and do like an hour Zoom like Q&A. So if you guys are interested in that, pop on my link tree above, and you can pop in if you'd like. Just want to let people know that that's available. I also will read your labs if you want some support. If you feel lost, I'm happy to help you, give you some guidance. Oh, Luli. So they recommend an MRI, but you're scared. Do you think it's cancer? So, it's hard to say for sure when they say lesion. It's hard to say what they mean when you say that. So I'd say for sure get an MRI, because we just want to know for sure. We don't want to have this worry hanging around. When you do an MRI, they'll be able to notice, like, is it a circular lesion? Is it fluid filled? We have lots of weird scar tissue and fluid filled things and lumpy, bumpy, weird things that are in our body that we have no idea are in there. And most of the time, they're very benign, and they're just like, oh, that's just interesting. Okay, well, maybe we'll watch that once a year, I guess, whatever, right? So we're going to assume that things are just like whatever, unless you got an MRI and you saw it differently, right? But I think that I would not assume that it was cancer. If they are calling it a lesion, it's probably not going to be their first stop. If you do a CT scan and it says there's a mass, that's where the rubber's hitting the road, right? A solid filled mass, you're like, oh God, that ain't good. So if they're calling it a lesion, it's often like a patch of scar tissue or a fluid filled area or something where they're like, it's not designated something specific. It's just kind of like a weird little artifact. So, but do the MRI just to make sure, right? We want to make sure. So, yeah, I wouldn't jump to cancer right away though. So, yeah. So, yeah, I'm excited that you guys hopped on. We got into some different topics today than just autoimmunity, and it's great. I just want to be here to answer some of your questions and give you guys some guidance and let you know that you're not crazy and give you some different choices. Oh, this happened in October and they want me to wait 3 months. Why? I mean, it's not like it's growing. I mean, I would just make the appointment, right? You'd be like, oh, oops, I got in early. I'm just going to get in the beginning of February, because who wants to be sitting around worried about that? I mean, what's the point, right? It's not like there's something that they're like, it's growing or something, but if they want you to wait that long, they're not that worried about it either. Okay. That's okay. I mean, we're not going to put anxiety where it doesn't belong, but it sounds like this has you worried. And, when you have things that are worrying you, it's going to cause you to lose sleep. It's going to cause you anxiety. It's going to cause, okay, no, yeah, you got to do it. Just doing it now. Yeah. Take charge of that and be like, listen, I'm not waiting. And then, yeah, do the MRI. Yep. Check it out. See what's up. Just so you don't have to worry anymore. Right. So, yeah, if I'm gonna be I'm hopping on lives every day. Like my friend Mindy Pels, who has this big following on YouTube, she's like, you have to do YouTube lives and TikTok lives every day for 90 days. So I'm going to be here every day for 90 days. Hi, Joseph. Hey, Joseph's just popping on and I'm just about to wrap up, but um, I want you guys to think about like those of you who are not being able to sleep well because you guys are stressed and all the things that are going on in the world. Passion flower and valerian root are literal magic sauce. Like before you jump on NyQuil PM and Tylenol PM and all the dumb things that we shouldn't be taking, get on something that has like valerian and passion flower. Wow, you guys have never been so knocked out. You'll be like, how did I not know this? So my favorite one is Neurosera. It's by Apex Energetics and it's a syrup. And literally it's in my fridge. And if I take a teaspoon of that and I'm like walking down my hall to go to bed, I'm already sleepy by the time I get to bed. Like it's literally like it's knockout drops. So think about that. Think about like, I don't really want you guys doing Benadryl to fall asleep and, all the medications, even, Ambien to fall asleep. Like, let's figure out the root cause of why you can't sleep. First of all, the country. I mean, come on, let's go with that. But also, there's other stresses, and we have to like make sure that we can sleep. Otherwise, we don't feel restored by the next day, right? We're going to feel exhausted, and it's just going to flare your autoimmune disease if you are feeling exhausted and you're not sleeping. Remember, I can't calm down autoimmunity from somebody who is not sleeping. Okay. So we have to prioritize sleep and we have to prioritize moving our body. And I'm happy to educate any and all of you about how to calm down autoimmunity because it's kind of what I do. I work on brain optimization and I work with autoimmunity. Those are kind of my niches. I mean, I'll do whatever you got, but I mean, those are my favorites. So, so I'm going to be back on tomorrow. I'm going to get on a little bit earlier tomorrow, a little bit before dinner. It's probably about 4:00 Pacific tomorrow after one of my autoimmune support groups. And so if you guys want to pop on another live tomorrow, I'm happy. Oh, Joseph says, I think I'm sleeping too much. Well, Joseph, do you need sleep? Are you exhausted? Like, sometimes if your body really wants to sleep a lot, you're fighting something. What if you're fighting a virus? What if you're fighting some bacteria? What if but maybe make sure you get up, and get your face in the sun, do a little 30 minutes of easy exercise to try to like get your cortisol up in the morning. Because once that your cortisol's up, you're going to feel more focused in the day. You're going to feel more energized. You're going to feel like you want to take on the world. But if you don't kind of get up and see the sun and you're kind of sleepy, you might not raise your cortisol as much. So maybe, Joseph, you hop up and get your face in the sun. If there's sun to be had, I don't know where you guys all live. It sounds like there's lots of snowy craziness happening out there. I'm in California, so we're not getting all that. But get your face in the sun at least. See the sun. Do a little exercise, even if you need to do, 10 minutes of just jumping jacks and squats. I don't really care. Just kind of like move your body. And then see if you can get your cortisol up in the morning. Okay. So, hey guys, I'm going to hop off. But I really appreciate you guys hopping on tonight. And I'll be back on tomorrow at 4 Pacific because that's what I get done with my autoimmune support group on Tuesdays. And I'll be letting you know what I'm finding. I'm finding lots of stuff, interesting stuff, you guys. And I'm glad you guys all hopped on. So I will, for those of you who want to hop on tomorrow. I'll be here. All right. See you guys soon.